Hi, my name is Megan Quinones. This presentation is about managing plantar fasciitis with manual therapy and stretching. Plantar fasciitis is an inflammation of the ligament that attaches the heels to the toes and supports the arch of the foot. It can cause severe heel pain and decreased function, and people may have issues with daily activities like walking. Risk factors include advanced age, increased exercise, a higher body mass index, occupation, and foot mechanics. Approximately 1 in 10 or 2 million people will develop plantar fasciitis in their lifetime. So how do we manage plantar fasciitis? One way is through manual therapy, and examples of that include joint and soft tissue mobilization, which are accessible and cost-effective. Other non-pharmacological methods include stretching exercises that would happen in physical therapy, or can be done at home. A common pharmacological intervention is corticosteroid injections, but with that there may be some complications such as plantar fascia rupture or atrophy of the fat pads. And the fat pads are a protective cushion that absorbs shock, so thinning of these pads can make exercise or even walking very painful. And for this reason, I focused on non-pharmacological intervention. The purpose of this synthesis and critical appraisal and my PICO question was to determine whether in patients with plantar fasciitis, how effective are manual therapy and stretching when compared to stretching exercises alone in improving reported pain and function levels by at least 7 points using the Foot Function Index tool over 6 weeks. The research databases I used to search for literature was PubMed and the Cumulative Index of Nursing and Allied Health Literature. And the search terms I used were plantar fasciitis, heel pain, manual therapy, mobilization, or stretching. The criteria for inclusion was that manual therapy needed to be an intervention for the experimental group. They needed to be peer-reviewed articles published after 2015, so within the last 5 years. The population should be plantar fasciitis patients, and I was looking for systematic reviews, meta-analyses, or randomized controlled trials. I excluded results where the full text was not available and where the comparison intervention was pharmacological, such as corticosteroid injections, because I wasn't comparing that in this case. And the Johns Hopkins Appendix E appraisal tool and a critical appraisal evaluation table was created for the evidence I found. 5 quantitative studies were included in the appraisal and synthesis. 3 were systematic reviews of randomized controlled trials. They were level 1, moderate quality, and the population were patients with plantar fasciitis in orthopedic or physical therapy clinics or tertiary care hospitals. One study included in one of the systematic reviews found no significant difference in measures using manual therapy as an intervention, but for the remaining trials, pain and function were significantly improved with manual therapy, and this included Foot Function Index as one of the outcome measures. And manual therapy forms that were implemented included soft tissue and joint mobilization and myofascial release. Myofascial release includes applying gentle pressure into the myofascial connective tissue to eliminate pain and restore motion. And these were measured at 4, 6, and 12 weeks with a significant improvement. But at 6 months or 12 months, there was not a significant change or improvement when compared to other treatment methods. 2 of the studies were randomized controlled trials. It was level 2, moderate quality, and the population was patients with plantar fasciitis in physical therapy clinics or hospital settings. In one study, manual therapy included soft tissue and joint mobilization, and when it was combined with physical therapy, it resulted in greater improvement in reported pain levels and function at 6 weeks compared to the control group. The form of manual therapy for the second study was joint mobilization, and it resulted in greater improvement in pain levels and function over 3 months using a pre and post test design. The study also showed decreased restrictions with sports and work and improvements with gait, so there was less instance of limping after manual therapy and physical therapy was implemented. Similarities of the studies included that they all measured self-reported pain levels and function levels, and they were in similar clinical settings with good quality studies. Some variations or differences of the studies, however, were that the follow-up time periods varied, so the least amount of time was 4 weeks and the longest amount of time for follow-up was 1 year. There were also some variations in the outcome measure tools, and the sample size varied from 19 participants to 70. Also, the forms of manual therapy implemented varied. So there could be soft tissue mobilization, joint mobilization, or myofascial release, for example. Does the evidence support practice change? There is sufficient evidence to support implementing manual therapy, such as soft tissue mobilization, as a non-pharmacological treatment for plantar fasciitis. Over a 6-week time frame, each of the studies reported statistically significant improvement in both pain and function, even when diverse measures were used as outcomes. However, there may be an additional intervention for long-term relief that's necessary, and there's a need for more high-quality focused studies using the same outcome measures. In conclusion, manual therapy, in addition to stretching techniques, are successful in improving function or disability related to plantar fasciitis, as well as decreasing self-reported pain levels. The impact is more efficient on a short-term basis, such as 3 to 6 weeks, when compared to 1 year. Manual therapy should be implemented in clinical practice as an early initial intervention, with emphasis on soft tissue mobilization and myofascial release for symptom management of plantar fasciitis. Thank you for listening.